Carpal tunnel syndrome, often abbreviated as CTS, is a common condition that causes pain, numbness, and tingling in the hand and arm. These symptoms can range from mild to severe and can significantly impact daily activities, making it difficult to perform tasks that require fine motor skills. It occurs when the median nerve, which runs from your forearm into your hand, becomes pressed or squeezed at the wrist. This nerve is crucial as it provides sensation to the thumb, index, middle, and part of the ring fingers, and also controls some of the muscles at the base of the thumb. The carpal tunnel is a narrow passageway in the wrist. It's a rigid, confined space that doesn't easily accommodate swelling or any increase in size. It's formed by bones and ligaments. The floor and sides of this tunnel are made up of small wrist bones called carpal bones, while the roof is a strong band of connective tissue called the transverse carpal ligament. The median nerve travels through this tunnel along with tendons that bend your fingers. These tendons are covered by a lubricating membrane called the synovium, which helps them move smoothly. When the tissues surrounding the median nerve in the carpal tunnel become swollen or inflamed, it puts pressure on the nerve. This inflammation can be due to various factors, such as repetitive hand movements, wrist anatomy, or health conditions like diabetes and rheumatoid arthritis. This pressure can lead to the various symptoms of CTS, including pain, numbness, tingling, and weakness in the hand and arm. These symptoms often worsen at night and can disrupt sleep. Understanding the anatomy of your wrist and the role of the median nerve is key to comprehending how CTS develops. This knowledge can also help in seeking appropriate treatment and preventive measures to manage or alleviate the symptoms effectively. Carpal tunnel syndrome can really cramp your style, literally. This condition, often caused by repetitive motions or prolonged use of the hands and wrists, can make even the simplest tasks feel like a challenge. One of the first things you might notice is numbness or tingling. This sensation can start subtly, often feeling like your hand has fallen asleep. It often affects your thumb, index, middle, and part of your ring finger. These fingers are directly connected to the median nerve, which is compressed in carpal tunnel syndrome. This sensation might come and go at first, making it easy to dismiss. However, over time, it can become more persistent and harder to ignore. It can be especially noticeable at night or when you wake up. Many people find themselves waking up to shake out their hands, trying to relieve the discomfort. As CTS progresses, you may also experience pain in your hand, wrist, or even up your arm. This pain can be sharp, shooting, or even feel like a burning sensation. The pain can sometimes be worse at night, even waking you up. This can lead to disrupted sleep and increased fatigue during the day. Weakness in your hand is another common symptom. This weakness can make it difficult to perform everyday tasks, such as holding a cup or turning a doorknob. You might find it difficult to grip objects, make a fist, or perform delicate tasks. This can be particularly frustrating if your job or hobbies require fine motor skills. In severe cases, CTS can cause muscle wasting, also known as atrophy, at the base of your thumb. This can lead to a noticeable decrease in hand strength and dexterity, making it even more challenging to perform daily activities. There's no single cause of carpal tunnel syndrome. Often, it's a combination of factors that contribute to the development of this condition. Repetitive hand movements, like typing or using vibrating tools, are a major risk factor. Your wrist anatomy also plays a role. Some people are simply born with a smaller carpal tunnel, making them more susceptible to CTS. Certain health conditions, such as diabetes rheumatoid arthritis, and hypothyroidism can increase your risk. Pregnancy-related fluid retention is another common culprit behind CTS in women. And let's not forget about injuries. Fractures, sprains, and dislocations in the wrist can all lead to carpal tunnel syndrome. The good news is that there are steps you can take to help prevent carpal tunnel syndrome from cramping your style. Ergonomics is key. Make sure your workspace is set up to minimize strain on your wrists. Take frequent breaks. Give your hands and wrists a chance to rest, especially if you're engaged in repetitive tasks. When you do use your hands, pay attention to your technique. Avoid gripping objects too tightly or bending your wrists at extreme angles. Strengthening and flexibility exercises can also help keep your wrists healthy. And don't forget to warm up those wrists before any activity that puts stress on them. Conservative care. Finding relief without surgery. In this section, we will explore various non-surgical methods to manage and alleviate the discomfort caused by carpal tunnel syndrome. If you're experiencing carpal tunnel symptoms, don't panic. It's a common condition, and there are numerous ways to find relief without resorting to surgery. There are many effective non-surgical treatment options available. These methods can help manage your symptoms and improve your quality of life. Rest is often the first line of defense. Taking regular breaks and allowing your wrist to rest can significantly reduce pain and inflammation. Give those overworked wrists a break and avoid activities that aggravate your symptoms. This means limiting repetitive motions and heavy lifting. Wrist splints can be incredibly helpful. They provide support and stability, especially during sleep when you might unknowingly bend your wrist. They keep your wrist in a neutral position, taking pressure off the median nerve. This can help reduce pain and prevent further damage. Your doctor may also recommend medications to reduce pain and inflammation, such as non-steroidal anti-inflammatory drugs or NSAIDs. These can be very effective in managing symptoms. Physical therapy can work wonders. A physical therapist can design a personalized exercise program tailored to your specific needs. A skilled therapist can teach you exercises to strengthen your wrist muscles, improve flexibility, and reduce nerve compression. These exercises can be done at home or in a clinical setting. They may also use techniques like ultrasound and nerve gliding exercises to alleviate symptoms. These advanced therapies can help improve blood flow and reduce inflammation, providing much-needed relief. The role of medication in CTS management. Medications can play a role in managing carpal tunnel syndrome, primarily by addressing pain and inflammation. Over-the-counter pain relievers, such as ibuprofen or naproxen, can provide temporary relief. Your doctor may recommend stronger prescription medications if over-the-counter options aren't effective. Corticosteroids, potent anti-inflammatory drugs, can be injected directly into the carpal tunnel to reduce swelling and alleviate pressure on the median nerve. However, it's important to note that steroid injections are typically not a long-term solution, and their effects may wear off over time. It's crucial to discuss the risks and benefits of any medication with your doctor to determine the best course of treatment for your individual needs. When surgery becomes an option. In some cases, surgery may be recommended to treat carpal tunnel syndrome. This is typically considered when conservative treatments haven't provided sufficient relief or if there's evidence of nerve damage. Carpal tunnel release surgery involves cutting the ligament that forms the roof of the carpal tunnel. This procedure helps to relieve pressure on the median nerve. Carpal tunnel surgery is usually performed on an outpatient basis, meaning you can go home the same day. While surgery can be effective in relieving symptoms, it's important to have realistic expectations. Recovery time varies, and you may need physical therapy to regain full wrist strength and function. Living with CTS. Practical tips for daily life. Living with carpal tunnel syndrome can be challenging, but there are ways to manage the condition and maintain a good quality of life. Making simple modifications to your daily routine can make a big difference. Use assistive devices whenever possible. For example, ergonomic keyboards, mouse pads, and jar openers can reduce strain on your wrists. Avoid activities that require repetitive hand movements or prolonged gripping. If you must engage in such activities, take frequent breaks and use proper technique. Pay attention to your posture. Poor posture can contribute to wrist strain. Maintain a neutral wrist position as much as possible and avoid bending your wrists at extreme angles. Maintaining a healthy lifestyle with CTS. Maintaining a healthy lifestyle is crucial for managing carpal tunnel syndrome and overall well-being. Regular exercise is essential for maintaining flexibility and strength in your wrists and hands. Engage in low-impact activities that don't aggravate your symptoms, such as swimming, walking, or cycling. Eating a balanced diet rich in fruits, vegetables, and whole grains can help reduce inflammation throughout your body, including in your wrists. Stay hydrated by drinking plenty of water throughout the day. Adequate hydration supports nerve health and can help prevent fluid retention, which can exacerbate CTS symptoms. The importance of early diagnosis and treatment. Early diagnosis and treatment are crucial for preventing long-term complications from carpal tunnel syndrome. If you experience persistent numbness, tingling, pain, or weakness in your hand or wrist, don't ignore the symptoms. See a healthcare professional for a comprehensive evaluation. Early intervention can help prevent the condition from worsening and may improve the effectiveness of conservative treatments. Your doctor can perform a physical exam, review your medical history, and order tests, such as a nerve conduction study, to confirm the diagnosis. A hopeful outlook: you can live well with CTS. Carpal tunnel syndrome can be a painful and disruptive condition, but the good news is that with the right approach, you can manage it effectively and live a full and active life. By understanding the causes, symptoms, and treatment options, you can take control of your health and find relief. Whether through conservative measures, lifestyle modifications, or in some cases surgery, there are solutions available to help you regain comfort and function. Remember, you're not alone in this journey, and there are healthcare professionals who can guide you towards a brighter, pain-free future.